Let's see what happens. Okay, ready? Says. Okay.
I'm very nice. I'm just brutally honest.
All right, watch. You guys got to get this. And again, remember I told you, like day number 1, I think, I'll never forget it. I explained to you that this equation would never leave you, right?
Yep.
So it's going to come back and haunt you. Well, hard cheese. This is acid-base balance in the body. Ready? Yeah. Okay. Now watch. What system controls carbon dioxide? That's beautiful. So watch. If you are not breathing enough, you're hypoventilating, you're not breathing as much as you should, what's going to happen to the amount of carbon dioxide in your blood? It's going to go up. So because it goes up, it's going to force the equation to the right, and you will form more free-floating hydrogen ions. Say yes. So what will hypoventilation do to the pH of the blood? It will decrease it, right? So you will have a drop in pH, and when you drop the pH below 7.35, and it's a result of the respiratory system, that's called a respiratory acidosis. And what does an acidosis do to neural activity? It suppresses it, right? Now, let's say, and I'll give you an example. At the end of the semester, you go on WebAdvisor, and you see your grade. Now watch. When people get anxious, they will start breathing faster than normal. Now, the normal stimulus for breathing is indirectly the buildup of carbon dioxide, yes? But if you are breathing faster and deeper and you're not producing any more carbon dioxide, what's going to happen to the amount of carbon dioxide in your blood? It's going to drop. So now, in order to maintain the balance of equilibrium on both sides of the equation, bicarbonate and hydrogen ions are going to combine and break down the CO2 and water. So you're reducing the amount of free-floating hydrogen ions. So what does hyperventilating do to your pH? Raises it. So you have a respiratory alkalosis. And what does a respiratory alkalosis or any alkalosis do to neural activity? So that's why people complain of like numbness and tingling in their hands, and they feel kind of dizzy, right, because of that increased neural activity.
So if you get tired, breathe more.
Yeah. Right. Now watch. What's the normal stimulus for breathing? Normal stimulus.
Increased CO2.
The increase in CO2 indirectly, buildup of hydrogen ions directly, right? We talked about this. So we also talked about the fact that you have peripheral chemoreceptors located where? Where? There you go. And those guys, they respond to drops in PO2. Now, think about this for a minute. Watch. I'm sitting here, and the PO2 is 100. I'm magically transported to the top of Mount Everest, where the PO2 is, say, 60. You got me? If I'm not any more metabolically active now than when I'm on the top of Mount Everest, you're following me. If I'm not making any more CO2, I shouldn't have to breathe anymore when I'm on the top of Mount Everest. Isn't that right? But these peripheral chemoreceptors are going to detect a drop in PO2. That's going to feed back on the medulla and cause me to breathe faster and deeper. So what will I produce as a result of a drop in PO2? What will you be getting rid of more? So what will happen to your pH? And what will happen to neural activity? Right. So the signs and symptoms of altitude sickness are the same signs and sickness of a respiratory alkalosis. They will get numbness and tingling, dizziness. Say yes. And you learn this, and I'll never forget it. It was a Monday. Watch. You got your alveoli, and you got your little pulmonary capillary, and you got your red blood cell. And that red blood cell's so big that it gets squished as it's going through that pulmonary capillary. Ain't that right? And we learned that you have carbon dioxide plus wah-wah makes carbon. Remember this? Okay? And that's going to break down to hydrogens and bicarbonate. Ain't that right? So what happens in the lungs is you have inside a red blood cell, you have carbonic anhydrase, that enzyme. That enzyme, and we learned about enzymes, that they increase the speed of chemical reactions. Remember that, Amanda? I'll never forget it. You also learned that enzymes can reverse chemical reactions, right? So at the lungs, what do you want to do? You want to take hydrogen and bicarbonate, combine it to carbonic acid, and break it down to CO2 and water. Tell me you got that. But if you do this in the lungs, when you're at altitude, you will be getting rid of more CO2. You don't want to do that. So the drug to treat altitude sickness inhibits carbonic anhydrase, and it prevents carbonic acid from being broken down to CO2 and water. So you retain those hydrogen ions because you're not getting rid of the CO2. That's how you treat altitude sickness. Say yes. You ever hear of a drug called Mannitol? Have you? Yes. Mannitol inhibits carbonic anhydrase. Now, I'm going to show you something. And if you get this right, I'm going to be proud of you. What are you shaking your head? This is great information, just so you know. Okay, I'm going to give you a real hard question here. Okay. Which side has more stuff, the left or the right? This is one stuff, this is two stuff. This is one stuff. You got me? So mannitol works as an osmotic diuretic. It takes this, converts it to that. So you got more stuff, and more stuff causes more stuff to be drawn into the blood. That's how it works as a diuretic. Okay, that was just a little thing. All you need to do is explain to me. This is one of those softball questions. All you got to do is write out the equation and tell me which way carbon dioxide, that equation goes when you hyperventilate or when you hypoventilate. And watch. No one's going to come into your emergency room doing this. I've been breathing like this for 17 years. Right? So the most common respiratory acid-based disturbance is a respiratory acidosis. So anytime you interpret blood gases, you always look for the acidosis. Always. Say yes. Did I explain the DKA? Did I? Yes or no? I can do it in 2 minutes. Really? I did the DKA. Watch. Now I'm going to show you from a respiratory standpoint. Watch it. Watch. Relating everything. These cells are getting less round. Do you know that? Please get this. In DKA, is your blood sugar high or low? My name is? It's very high. And when you are in DKA, diabetic ketoacidosis, your blood sugar is really high, so you have no insulin. Remember this? You got me? So if you don't have any insulin, can you get what up, G, into the liver? So what does the liver think? Your liver thinks you're starving. So your liver takes fat and makes the ketones. Beta, hydroxy, butyric acid, acetic acid, and acetone. Those are the ketones. And what do? You dump those into the blood. And why are you dumping ketones into the blood? Because you feed the brain with these guys. The brain cannot use fat, but if you ain't got no insulin, it can't use glucose, so it will use the ketones. What are the ketones? They are acid. So what's going to happen to the pH of your blood as a result of you dumping ketones into it? And what caused the buildup of keto acids in your blood? And if you ain't got no insulin, what are you? So you went into a diabetic ketoacidosis. Okay, now watch. This is where the equation comes back. Watch it. Who's watching? I'm going to do this really good. I'm going to make it really good. Draw my good tube. Look at that. That was a good carbon dioxide. Very good.
Oh, it's the blow of CO2. It's like compensation.
Yes. What's the goal of the body? I haven't used that one in a while. If you get this, this is high-level thinking. And this is exactly what you need when you get into your little clinical phase. Ready? Watch. You started making hydrogen ions through metabolism. What's floating around in your blood that will grab those hydrogen ions? What else? Bicarbonate. So if the amount of hydrogen ions goes up in the blood, what's going to happen to the circulating level of free bicarbonate? It's going to go down, right? Because it's grabbing those extra hydrogen ions. So it's going to make the equation go this way. So what's going to happen to the amount of carbon dioxide formed? And what system controls carbon dioxide? So if you make acid at the cell, you have to get rid of more acid at the lungs. So how are these people going to breathe? Faster and deeper to get rid of the excess CO2 so that you can balance the right and left side of the equation. You're making acid at the cell, the liver cell, so you got to get rid of acid at the lungs to maintain your pH. Say yes. That is beautiful. Do you understand that? That's high-level thinking. If you get that, you'll get at least a D in this class. You got to pee right now?
I need a B minus.
Oh. Tell me you got that. Now, watch. What's the only system that can compensate for a metabolic acidosis? The respiratory system. The only system that can compensate for a metabolic acidosis. You're making acid at the cell. What's the only system that controls carbon dioxide? So the only system that can compensate for a metabolic acidosis is the respiratory system. And what's the only system that can compensate for a respiratory acidosis? The kidneys, because the kidneys control bicarbonate. How many people follow that? I'm going to tell you right now, if you really get that, you are light years ahead of everyone else. I kid you not. If you truly understand that. If you don't, you're going to remember respiratory opposite, metabolic equal. Ain't that right? That's how they teach you. Right. I teach you so you understand it. I hate me too, Anna, just so you know. Well, you should. I mean, for real. How many people got that? Okay. Boom. I did asthma, right? I know I did, right? I didn't? Okay, well, don't worry about it. So I just did numbers 8 and 9. Number 11, that's extra credit. I'm not going to tell you. Number 11. You should be able to figure that one out yourself. Okay.
Also why you can't reach 100% at...
Yeah, and I'm not writing that on the quiz. If you don't write it on, you ain't getting no extra credit.
Right.
Yep. I like that. You got to, what? 100% on the, yeah, you better tell them. I'm not telling them.
Well, you can, but why you don't ever reach actual 100% concentration on
right. And that's all I'm saying about that.
It's air. Like in the pulse box, it'll say you will, but it's not actually.
Right.
It's a lie. They're lying to you.
Yeah. Or nail polish. What's the difference with nail polish?
It makes the, because they use it's not ultraviolet. It's, is it infrared? It's red. I don't know. It's infrared? Yeah. Okay, here we go. What the hell? Who's that? She's on Bing. All right, ready? Okay, watch. And this is going to help you. This will. Because it's going to take us into a couple of things. Now watch. Watch. Asthma, you can't even come close to seeing that. Asthma is an allergy in your respiratory tract. Now watch. What is the function of the immune system? Your immune system protects you. Your immune system protects you by producing inflammation. Do you remember when I went over the respiratory lining and I told you that it was very vascular? I made a point of saying that, didn't I? Never forget it. So watch. And you need to get this. You need to understand this. Which one's the pen? Does that say pen?
Yes.
Okay. So watch. The lining of your respiratory system is very vascular, meaning there are a lot of arteries. What are arteries made out of? And what are the two things that muscle can do? Watch. When you twist your ankle, what does your ankle do? It swells. And the reason it swells is because the blood vessels within that area of damaged tissue dilate. You got me? So watch. Asthma is an allergy in the respiratory tract, and there's two hallmarks of asthma. It's an allergic reaction. And watch, I'm not going to write this down. An allergy is an exaggerated immune response. It's an exaggerated inflammatory response that occurs primarily in the bronchioles. And the bronchioles are made of muscle, smooth muscle, bands of smooth muscle. And what are the two things that muscle can do? That's it. You better write this down. Better not pout. On the smooth muscle of the bronchiole, you're not going to believe this, you have beta-2 receptor. What binds the beta receptors? Boom. You have, in the blood vessels that line the bronchioles, you have beta 1 receptors. What binds the beta 1 receptor? Epinephrine. Now watch. What does epinephrine do when it binds the beta 1 receptors in those arteries? It causes them to constrict. Say yes. When epinephrine binds the beta 2 receptors in the... Now think about this. When you're running or fighting for your life, do you want your bronchioles to be open or closed? Open. So when epinephrine binds to beta 2 receptors in the bronchioles, it will cause the muscles to relax and the bronchioles to dilate. When epinephrine binds to beta 1 receptors in the lining, the vascular lining, it causes the blood vessels to constrict. Say yes. Yes, they do. With the primary function of making that bronchial lumen bigger so you can get more air in and out. It's perfect. It's
Specify, like when you're giving epi, how do you know if it's binding to...
It's binding to both.
Yes. So when it binds to one, it does one thing. When it binds to the other, it does the other.
So that's why
Okay,
beta 2 is in the smooth muscle of the bronchial wall. And when epinephrine binds there, it's going to cause that muscle to relax and the bronchial lumen is going to get bigger. When epinephrine binds to the blood vessels, beta 1 receptors that line the lumen itself, the bronchial lumen, it's going to cause those arteries to constrict. So the lining, the blood vessels are constrict, so the lumen gets bigger. Say yes. Now,
why does it get bigger when they...
Because, okay.
You know that, watch.
One is one is the other.
Watch.
Yeah.
People don't get that, and I'm glad you brought that up. Watch. These are the blood, here are the arteries that are lining your bronchioles. You got me? So watch. When you get an allergic reaction, it's going to cause those blood vessels to dilate. So now, this vascular lining is going to swell. So what's going to happen to the actual opening of the bronchiole? It will get smaller. Tell me you followed that. And now this is important. I just want to tell you this. In the allergic reaction in the lungs, right, when you get asthma, they used to think it was histamine related, so they tried treating asthma with an antihistamine. Didn't work. What they found is that cells of the immune system were producing these things. They're called leukotrienes. Leukotrienes release, you're not going to believe, what's the most important element in muscular contraction? And it is the calcium that causes the bronchial muscles to spasm, to contract. So have you ever heard of a drug called Singulair? Guess what Singulair does? It inhibits the production of leukotrienes. That's what allows the bronchioles to stay open, and that's why you can take that medication orally. Claritin is an antihistamine. Singulair, a leukotriene inhibitor. Singulair. How many people followed that? Now, watch. What, like, when I was married, how many people here are married? How many people here are happy? I'm just playing. Anyway, I don't want to get in that. Watch. My ex-wife's brother, and he was married, and they weren't making much money. And I had this big 5-room house, and my son wasn't even born yet. So I said, look, why don't you come and live here? You don't have to pay any rent. You can save money, right? And then you can make a bigger down payment on the house. They're like, oh, that's nice. Well, they would always ask, hey, how come Tim never comes over to our apartment? And my ex-wife, he's deathly allergic to cats. So I figured if I gave them that option, that they would find another accommodation for their cat. For 11 months, I lived in my house with that cat. I could not believe that. And guess what the last thing was when they moved out? No good deed shall go unpunished. All right? So watch. If you have a cat, and we're going to make it black because cats are evil. You pet a cat. Here, kitty, I pet the cat, right? And cat hair and all that stuff goes flying. And you go, and you suck it in. I'm allergic to it. So what's an allergy? It's an exaggerated immune response. And what's the primary function of the immune system? To produce inflammation. And how you produce inflammation is by causing massive arterial vasodilation. So what's going to happen to all of the blood vessels in the lining of my respiratory tract? It's going to dilate. So what's going to happen to the lumen hole? It's going to get smaller. And we learned, I'll never forget it. It was a Monday. The Q equals airflow divided by airway pressure over resistance to airflow. And what determines the resistance to airflow? The diameter of the bronchioles. And now the bronchial diameter is getting smaller because of that inflammatory response. So if the airway resistance increases, what has to happen to the airway pressure? It has to go up. And you better write this down because I'm only going to say it. I'm not going to write it down. I'll write it down in Greek. That says, that's close enough. In order to increase airway pressure, you have to increase lung volume. So how do people with asthma breathe? They're trying to overcome that resistance. And as a result, you better get this, as a result of that inflammation in the lungs, you will get the release of leukotrienes. And what do leukotrienes release? Calcium. And that will cause the muscular wall of the bronchioles to spasm. And you will get the classic hallmark symptom of asthma, and that is bronchospasm. And you better know this. In the bronchioles, without asthma, air likes to flow in a laminar fashion, nice and layered. But when you get the bronchospasm, the wall of the bronchiole becomes wavy, and that air flows turbulently. And turbulent airflow produces wheezing. That's why people wheeze with asthma. Who's following this? Watch. Now, think about this for a minute. What do you want to do with the blood vessels that are lining the bronchioles? What do you want to do? Now that you got asthma, what do you want to do? You want to constrict them. So what constricts arteries? Right, and you don't want to give them a shot of epinephrine, right? You want to give them something that mimics epinephrine. So albuterol mimics epinephrine. I'm going to teach you terms. I just got an email from a student. She goes, Tim, thanks for teaching us some of that pharmacology because it really helps. She goes, I got an A in pharmacology. And I go, how does that benefit me? Why are you even telling me this? How does it help me, Anna? Yeah, well, who cares? It doesn't. All it made me do is waste my time, and I read that thing. I want money. Now you're just wasting my time right now trying to explain how I was... Okay, watch. Wait a minute. Okay, watch. When you stimulate a beta receptor, right? Beta receptor, when you stimulate it,